Happy New Year, Yolo County. I'm Dr. Amy Sisson, Yolo County's health officer, and I'd like to share a few messages about the regional stay-at-home order, coronavirus testing, and the coronavirus vaccine. 2020 was a difficult year on many levels, and nearly all of us are relieved to see it in the rearview mirror. I know that I am entering into 2021 full of hope for a better year ahead. Having 2 highly effective vaccines against coronavirus offers the possibility of life returning to normal later this year. But it will be a while before enough people are vaccinated to safely resume our pre-pandemic lives. In the meantime, the virus continues to spread in the Yolo County community, and we must continue taking precautions to avoid infection. December was a difficult month COVID-wise. More Yolo County residents were infected with coronavirus during December than in any other month of the pandemic. Case rates reached the highest they've ever been, and testing positivity rose to 13.7%. A testing positivity rate of 13.7% means that nearly 1 in 7 people getting tested is infected with the virus that causes COVID-19. During December, our hospitals took care of more COVID-positive patients at one time than ever before and had to shift their bed capacity to make room for these patients. Across the 13-county Greater Sacramento region, the number of beds left in ICUs dropped low enough to prompt the state to issue a stay-at-home order for the region. The stay-at-home order will continue until models of ICU bed availability show that at least 15% of beds will be consistently available for the next 4 weeks. For now, new cases of COVID-19 have leveled off, but widespread travel and gatherings over the recent holidays will likely lead to another surge in cases 2 to 3 weeks from now. Any surge in cases would be expected to be followed by a surge in hospitalizations 2 weeks after that. This means we are not out of the woods yet, and our hospitals could very well become strained over the next month. Please don't become a statistic. Stay home as much as possible. If you do go out, wear a mask and stay 6 feet away from people you don't live with. Avoid gathering with people you don't live with, but if you must gather, wear masks, keep your distance, and meet outdoors or with the windows open. Small particles containing the virus can build up in indoor air and spread disease, which is why outdoors is a safer option. One of the reasons why coronavirus is so hard to control is because it can be spread by people who feel perfectly fine. In fact, 2 in 5 people infected with coronavirus don't have any symptoms. Others have mild symptoms that may seem like allergies, but are in fact COVID-19. The only way to know that you aren't infected with coronavirus is to get tested. Anyone with symptoms should get tested. So should people who feel fine, but have been near someone infected, or who spend a lot of time around others at work or during other activities. There are several free testing sites in Yolo County, and we are adding more. You can receive free COVID testing in Woodland, Davis, Winters, West Sacramento, and more. Please visit covidtesting.yolocounty.org for details about testing locations. In addition, you can get tested through your regular healthcare provider. Symptoms of COVID-19 may be a lot like a cold, so don't ignore mild symptoms. COVID symptoms include fever, chills, cough, shortness of breath, sore throat, headache, body aches, runny nose or congestion, loss of taste or smell, nausea, vomiting, or diarrhea. If you have any symptoms of COVID-19, please get tested and stay home while you wait for your test results. If you've spent time with someone diagnosed with COVID, you should stay home too. The good news is that most people only have to stay home for 10 days after coming into close contact with someone with COVID-19, instead of the 14-day quarantine period required before. Staying home in quarantine keeps you from spreading disease to others if you become infected after an exposure. Next, let's talk about coronavirus vaccines. 2 vaccines have now been authorized by the FDA to protect against coronavirus infection. Both vaccines are safe and highly effective and give me tremendous hope for the future. These vaccines are new, but they've been tested and proven to work in large clinical trials in several countries. I have reviewed the data and wholeheartedly recommend the vaccine. I received the vaccine myself, and the only side effect I experienced was minor soreness in my arm for a couple of days. During the second half of December, Yolo County received 4,450 doses of vaccine. We are working quickly to distribute the vaccine based on the guidance from the state of California on who gets the shot first. However, this rollout takes time to organize with agencies, schedule staff, and work out the logistics of vaccinating so many people. Yolo County has over 220,000 residents, so the doses we have now are nowhere near enough to vaccinate everybody. Each phase and each tier of the vaccine rollout goes in order, so in general, we won't move into Tier 2 of Phase 1A until Tier 1 is done, and we won't move into Phase 1B until Phase 1A is done. However, there may be some slight overlap as we transition between tiers and phases, especially if doses are nearing expiration. During Phase 1A, healthcare workers and residents of long-term care facilities can get vaccinated. During Phase 1B, older adults and frontline workers will be eligible to get the vaccine. The timing for when Phase 1B begins depends on how many doses of vaccine we get from the state, as well as how quickly we are able to move through Phase 1A. We are estimating that Phase 1B will begin in late January, but this may change. When we finish Phase 1B, we will move to Phase 1C, during which other essential workers and people with underlying medical conditions will be eligible to receive vaccine. After Phase 1C, we will enter Phase 2, during which the general population can get vaccinated. The vaccines are only authorized for people 16 and older, so children cannot be vaccinated yet. Clinical trials involving children are currently underway, however. If you have questions about the vaccine and when it will be your turn to get vaccinated, please visit the Yolo County COVID vaccine webpage at www.yolocounty.org/coronavirus-vaccine. I look forward to a time this fall when everyone who wants a vaccine will have received one. Until then, thank you for your patience and for continuing to take steps to protect yourself and others from COVID-19. Thanks for listening.